delight to be back here with you this morning. We're so excited to start day 2 of MedX. I hope you have your MedX tissue with you today. As you learned yesterday, you'll need it. And I hope you had a great time at our reception on the lawn yesterday. So many great talks and sessions yesterday, and we have even more greatness today. I hope you've gone through your app and your agenda and picked out all the sessions. I know there have been some tough choices, but having a lot of great choices in my mind is a great thing. And I just have a few quick announcements. But first of all, I just want to, wow, that opener movie, so inspiring. That was from our Medicine X Ed conference last year. And we're going to hear a little bit more about our plans for Medicine X Ed this year in a second. But really inspirational, because as much as we're trying to change the culture of healthcare, we want to make it not about changing something, but that it is the culture. And that starts with that next generation of leaders, patients, medical providers, allied healthcare professionals who are going to be leading tomorrow. And that's really the legacy of ED and what we're trying to do. And I thought this, one of our little thank you notes outside. You guys still have your cards? You're working on finding your inner superhero and your thankful moments. This to me really resonated because it's a sign that MedX is changing things. We are making a difference, that next generation of learners. I'm thankful for the advice and support from the MedX community as I begin my medical training, so that what we're talking about here today, the vision and values that Medicine X represents and that we share in this room, is just the way things are. It is the way it has always been, and it is the way that it will be. So notes like that make me really thankful. Please keep posting those notes outside. Generous offers of help, really compelling offers of need, and let's come together as a community and really drive some great co-creation. So look for your team leader, your team members here at MedX. Work on those cards today as you are inspired in the sessions that you attend. I also want to announce that Quarry will be in the lobby. We have a great feedback forum area that they're set up, and they're really there to get feedback from our MedX community as they move into their next phase as an organization to disseminate the knowledge and evidence that their studies are generating. And they want to do that in partnership with patients and engage patients as reviewers of that material. And they're inviting everybody to go out there into their Quarry space, which is right next to, it is actually where our photo studio was yesterday, right across from the registration desk. Your feedback is so important. The work that Quarry is doing is so important. And I want to make sure that we have a chance as a MedX community to give our advice to them. And they're here because they want to hear from us. They want to listen to our expertise. So please go out there and spend a little time with them. Reminding you about the hub, which is our tents outside on the lawn there. MedX Studio. If you haven't yet had a chance to visit MedX Studio, please go and do so. You're going to hear a little bit more about that from Monica Wittig today. Our demo tent is still up. If you haven't had a chance to see some of the amazing demos, you should definitely go and see those technology demos out there. And participants as research partners, a special workshop session with Nick Dawson from the Sibley Innovation Hub at Johns Hopkins and Claudia Williams. That's from 2:30 to 4:30 in the Precision Medicine Everyone Included tent. So those sessions are great. Make sure to check those out. Of course, everyone in this room made the right decision today by coming early, so you're not going to miss, and you will have a seat for our ePatient Ignite talks. And also we have another group of talks on Sunday morning. You don't want to miss those. And our C3 live pitch, which is today at 12:40 p.m. And you really don't want to miss this session. Come early so you can get a seat. We're going to hear from patients, caregivers, innovators from the community, sharing their ideas about how to advance cancer care. And we'll have a great panel of judges, including our own e-patient in residence, Michael Sears, Robert Herjavec from ABC Shark Tank show will be there. But really, it's a chance to hear ideas coming from the community about how to make real changes in the world. So I really hope that you'll be here for that. Of course, I know you've already rescheduled your plane tickets. You've already canceled your plans to be somewhere else. And you've told your friends you're going to miss their wedding because you're going to be here to see Yoko Sen, our artist in residence, as she debuts a new piece of work of sound alchemy, where she will layer in interviews of our MedX community that she does here as sound layers into this piece of work. So I'll also try to look for Yoko and participate in an interview with her. I believe that we have a spot set up for her in the Legacy Maker tent, but if you walk into MedX Studio, you should be able to find her around the corner. I know she'd love to spend some time with you guys. Of course, I really want to take a moment to thank the sponsors of Medicine X that really make our work possible. As you know, I said yesterday, our ticket prices, our registration revenue only cover actually only 1/3 of the cost of making this an everyone included program with our live stream and our cameras and our stage and our team of our crew that makes this all possible. So I want to thank them, Stanford Department of Anesthesia, my Stanford AIM Lab, IROM Group, Astellas Oncology, Eli Lilly and Company, Boehringer Ingelheim, Nuance, our friends at the Risk Authority, 11 Health, Johns Hopkins Sibley Innovation Hub, and these really great sponsors. And of course, our friends, our dear friends at Stanford Healthcare who have been with us since the beginning as a sponsor. I really want to thank all of these great sponsors for making Medicine X possible. Let's just give them a big round of applause right now. Thank you so much. And I want to use my last bit of time to update you. What are the plans for Medicine X Ed, which is the ambitious work we started last year of launching a second conference on the Medicine X brand dedicated specifically to looking at the future of medical education, where we place the patient again at the center of what we're doing. So with that, I want to invite Kirsten Oster to the stage to help me update you. All right.
Hello.
So we were here last year doing Ed.
Yes.
Then the year before we announced it. So let's talk about the update.
Right. So first of all, the dates for next year. We're happy to announce that Medicine X Ed will take place April 22nd and 23rd of 2017 right here at Stanford.
So we're coming back. We're coming. I have to celebrate that. We're coming back. We're going to do a second conference.
Yay.
So for some of you may be wondering what happened. Why aren't we doing it now? Monique and I sat down and we said, we really want to do it again, but we can't do two back to back. It's too much. So we're going to stagger it. We're going to have a spring conference. And one of the big reasons why it's happening is because an organization stepped up. They felt that the work was too important not to happen. They felt that this idea of placing the patient again at the center of what we're doing when we focus in on medical education was too important. So I really want to thank Quarry, who stepped up and said, we are going to give you enough resources that Medicine X can make Medicine X Ed happen again for the next 2 years. So really, Quarry, it's amazing. And it's going to really, I think, energize our ability to continue the important discussions and to talk about, it's actually an exciting time, to talk about the evidence that's coming in from the Quarry studies, looking at patient-centered outcomes. So how are we going to teach the future generation of providers, but also how are we going to teach patients to take that evidence and understand that evidence, teach it to each other, and then in a shared decision-making manner, make the best decisions about the treatment, right treatment for each person. So I think it's a tremendous opportunity. What was your favorite part about Ed last year?
Well, I really loved the way that we kind of took all of the exciting innovation that we talk about here and all of the new discoveries, the new technologies, and just the idea that patients and doctors really need to partner together. And we brought that to the place where future doctors and future healthcare professionals can learn that, so that not just the doctors and the other health professionals who come to Medicine X, but really future generations, future leaders can start learning this as not just like a cool idea, but as something that is integral to their education, as something that is absolutely necessary to the way that they practice medicine going forward.
Absolutely. I think for me, one of my key takeaways was kind of looking at, this vision, this idea we have of elevating the underheard voices in medicine. And at Medicine X Ed, it was really striking. The underheard voices in the room, besides patients, were actually the students themselves.
Yep, that's right.
The students saying, the system isn't meeting our needs.
Right.
We're a different generation of learners. And since you're not meeting our needs, we're creating it for ourselves. But recognize that we're good partners. We have expertise to offer. And I think it was an eye-opener for everyone in the room. So so anyways, really exciting that we're going to have that opportunity to do it again in April. We should also thank Brian, who can't be here today.
Yes. Brian Vardabedian is the co-chair, the director for next year of the Education Advisory Board for Medicine X. And unfortunately, he couldn't be here today or he would be standing right here. But shout out to Brian. I think he's watching the live stream.
Yes, he is. Hi, Brian. Thank you so much. Okay. We need your help. Come back. Help us.
We need your help, too.
Yes.
So the registration website is open. It's ready to receive your submissions. We really need all of the brilliant minds, the brilliant ideas in this room to come and help us really transform the future of medicine by transforming education. So please submit proposals to give talks and tell your friends and your colleagues, bring them so that we can really move this momentum forward into the future.
Absolutely. And the other challenge I gave to myself is with the new conference, it comes a new opportunity. So we're actually going to look at Medicine X Ed as an opportunity to create an everyone-included conference focused on education. But to do it now, let's think about what are the realities that educators face. We as educators live in a low-resource environment. We don't have big budgets to attend conferences. We don't have big budgets to implement new technology. So Medicine X Ed is going to be a conference where we challenge ourselves to do an everyone-included conference on a tiny, tiny little budget. So we're going to actually be still at Stanford. We're going to be at the Engineering and Science Quad. We're going to actually have a great new building to do Medicine X in. So there's actually many more reasons to come to Medicine X Ed and a lot of challenges ahead. So please consider submitting a speaker proposal. And visit our website. If you go to our website and look in under, on the main page, on the menu, there'll be Medicine X Ed 2017. So click on that and really join us. We can't wait to see you all again, hopefully in April. So thank you. And I think that's my wrap up. You'll see me here again just to say a few words for Shark Tank, but that's at 12:40. So until then, all right, thank you so much.
All right.